and we don't maybe necessarily measure, washing hair in a clinical trial, but for patients, it's really important, right? That you're able to do functions of daily activity, right? These things that are things that you're doing day in and day out, and they're not maybe measured in the study, but they are helping you in terms of your own quality of life. So I think that's really important. What are some trends that you see, Rohan, that are emerging in health economics? And how do you think these trends may have impacted healthcare policies globally?
Yeah, that I think that's a fantastic question, and I'll go back to my experience at one of my previous companies where I worked on blood-based biomarkers, and so these blood-based biomarkers were essentially indicators of traumatic brain injury, and with some of these indicators of traumatic brain injury, right? For example, if an individual gets into a car accident or gets a concussion and they have a suspected brain bleed or some sort of internal hemorrhaging, it's very easy for individuals that are in cities like Raleigh or a little bit less dense cities to get to an emergency room and then get into a hospital and potentially even get a CT scan if needed. But a lot of places don't have readily available resources like that.